On the 1st of December, we celebrated World AIDS Day. Millions of people around the world gathered together to remember and share information about this topic. But what is AIDS actually? Before knowing what AIDS is, we need to find a definition for HIV. Do you know what HIV is? HIV stands for Human Immunodeficiency Virus. HIV is a virus that attacks the CD4 cells that help the body fight infection, making a person more vulnerable to other infections and diseases. The human body can get rid of HIV, and no effective HIV cure exists. So once you have HIV, you have it for life. This sounds terrifying, doesn't it? But don't worry, effective treatment with HIV medicine is available. This medicine is called ART, that stands for antiretroviral therapy. It consists of 7 types of different drugs that your doctor combines depending on your necessities and other factors. If taken as prescribed, HIV medicine can reduce the amount of HIV in the blood, also called the viral load, to a very low level. This is called viral suppression. If a person's viral load is so low that a standard lab can detect it, this is called having an undetectable viral load. People with HIV who take HIV medicine as prescribed and get and keep an undetectable viral load can live a long and healthy lives and will not transmit HIV to their HIV-negative partners through sex. Can I ask you a question? Do you know how much HIV medicine costs? If there's a generic version of your medication, that can lower your cost. However, the average wholesale price for the drugs is nearly $1,700 for a 30-day supply of tablets in the USA. That's too much. A good question also to do is, how is it spread? It is spread by contact with certain bodily fluids of a person with HIV, most commonly during unprotected sex. So meaning sex without condom, or through sharing injection drug equipment. Let's talk about the test services. The only way to know for sure if you have HIV is to get tested. Testing is relatively simple. You can ask your healthcare provider for an HIV test. Many medical clinics, substance abuse programs, community health centers, and hospitals offer them too. To find an HIV testing location near you, use the HIV services locator. We will leave the link in the description. HIV self-testing is also an option. Self-testing allows people to take an HIV test and find out their results in their own home or either private location. You can buy a self-test kit at a pharmacy or online. There are 3 types of HIV tests: antibody test, antigen antibody test, and nucleic acid test. First, we have the antibody test that look for antibodies to HIV in a person's blood or oral fluid. Antibody tests can take 23 to 90 days to detect the HIV after exposure. Second, the antigen or antibody test look for both HIV antibodies and antigens. It can usually detect HIV from 18 to 45 days after exposure. And the last one, NATs, so nucleic acid test, looks for the actual virus on the blood. This test should be considered for people who have had a recent exposure or a possible exposure with early symptoms of HIV, and NAT can usually detect HIV from 10 to 33 days after exposure. From Praxis, we really recommend to do a test, at least once, to be secure if you have the disease or if you don't. Because if left untreated, so without taking the ART regimen, HIV can lead to the disease AIDS. AIDS stands for Acquired Immunodeficiency Syndrome. AIDS is the late stage of HIV infection that occurs when the body's immune system is badly damaged because of the virus. A person with HIV is considered to have progressed to AIDS when the number of their CD4 cells falls below 200 cells per cubic millimeter on the blood, or if they develop 1 or more opportunistic infections regardless of their CD4 count. Without HIV medicine, people with AIDS typically survive about 3 years. Once someone has a dangerous opportunistic illness, life expectancy without treatment falls to about 1 year. HIV medicine can still help people at this stage of HIV infection and can even be life-saving. But who starts HIV medicine soon after they get HIV experience more benefits? That's why HIV testing is so important.